The forklift in the rhino enclosure and the team of at least 40 people around it were some of the signs that Tuesday was not a normal day at Brookfield Zoo. So was the bellow that came from the general direction of Layla, the zoo's 7.5-year-old eastern black rhinoceros with profound dental issues. That noise, Dr. Michael Atkinson, the zoo's vice president of clinical medicine, confirmed was the tranquilizer dart striking the animal in the leg, where the animal's thick hide is a little thinner. For the next 6 hours, aided by a subsequent IV anesthesia drip, Layla would be off in whatever dreamland it is that rhinos visit, while an elephant ventilator helped her breathe and teams of specialists helped her live. She would become, for the second time, the first living rhino to undergo a CT scan, and she would have a second groundbreaking head surgery to deal with life-threatening infection and sinus blockage resulting from an impacted unerupted molar. This has been a very tough case, Atkinson said. It's a huge team effort to try and help this animal. It began this winter when staff noticed the animal having difficulty breathing. You could hear just the abnormal airflow, he said. That kind of progressed into her breathing with her mouth open, with this loud roaring noise in it, kind of like a person snoring. Rhinos, like horses, breathe through their noses, so any airway blockage is menacing, even without an infection. This is a condition that she would not be able to survive, Atkinson said. This infection had blocked off her airway through her nose entirely and was causing her a lot of distress in her breathing and was leaving her in a very compromised state. The efforts that would be undertaken to save Layla would eventually involve a one-of-a-kind medical device, teams of specialists flying into Chicago, a 3D printed model of Layla's skull at 80% scale, and a whole lot of maneuvering of an unconscious pachyderm by zookeepers engaged in what looked like a tug-of-war, and yes, forklifts. But for all of the hard science in effect, there was something deeply human about the effort. As the animal lay insensate later Tuesday, strapped to a gurney with its snout at the edge of the CT scanner inside the zoo's pachyderm house, an anesthesiologist leaned over to a colleague and shared some music. "Layla," he sang, plaintive, the way Eric Clapton did in the Derek and the Dominoes hit. Taking care of Layla and others like her is vital, of course. Her species is critically endangered in the wild, and zoos hope to boost the population with breeding programs as well as awareness of the crisis generally. It was big news when King, an eastern black rhino baby, was born at nearby Lincoln Park Zoo in 2013. Also, if you have not done so already, please subscribe to our channel and click that notification bell to get inspired by these animal stories every day. Now, back to the story. A huge part of the problem for rhinos is poaching for their horns, which some cultures believe have special powers. Science disagrees. The cousin western black rhinoceros has been hunted to extinction, according to wildlife groups, while the eastern species is at least seeing improving numbers thanks to extraordinary conservation efforts. About 5,300 black rhinos live in Africa today, up from 2,300 in 1993. That number represented a 96% decline from their 1970 population, according to the International Rhino Foundation. It was knowledge gained through dealing with poachers that helped Brookfield treat Layla. First, Brookfield staff put Layla under anesthesia at the end of January for a first exploratory surgery with an endoscope. They were able to determine there was a foreign mass in there causing the blockage, but we could not get the size of it, Atkinson said. That was what prompted us down the path of, we need to get a CT scan done. The zoo reached out to Samsung, which just happens to make what it bills as the world's first battery-powered portable computerized tomography machine. Samsung and Neurologica, a subsidiary, were fantastically gracious in making this happen, Atkinson said. We weren't really sure if it would have the ability to penetrate through the rhino skull or not. We knew we were pushing the boundary to get imaging like this done on a live rhino. The first CT scan on April 19th revealed the impacted molar, which made it the likely cause of the infection and the mass that had grown up into the animal's sinuses. For a first dental surgery, May 7th, the team included doctors from the North Carolina State University College of Veterinary Medicine who have learned about Rhino's challenging cranial structure in part by working to rescue wild animals who have had their horns hacked off by poachers. In the procedure, the tooth on the left side of Layla's mouth was broken up and then extracted along with a mass of infected tissue that had spread mostly to the right side of her head. Afterward, she showed remarkable improvement, Atkinson said. The animal has also been receiving antibiotic treatment to fight the infection. But he knew another scan would be important to determine what was still in the rhino's head and whether more surgery would be needed. The scan is just critical in being able to plan, he said. A rhino's skull is a very difficult place to work surgically. The bones are so thick, the skin is so tough. Which brings us back to Tuesday. The immediate goal was to get the 2,300-pound animal from Point A, her indoor enclosure in the zoo's pachyderm house where she was put under, to Point B, the hall in the middle of the building from which visitors see the animals on days that it isn't closed to become a rhino medical clinic. There was set up the Samsung Body Tom, a device that surrounds the imaging donut with screens and wheels and signs on either side reading "Not for human use." It was only about 20 feet away as the crow flies, but to do it as the sleeping rhino travels meant going out through the animal's yard and around and back in through the doors of the hall. These 100-plus yards were sort of a planes, trains, and automobiles odyssey, except that it involved a portable gurney, ropes, straps, pillows, a wheeled gurney, no less than 3 separate forklift-type machines, and so many counts of 1, 2, 3 from staff preparing to heave and hoe that the numbers began to blur together. "All right, grounds, we're going to ratchet her in place," said Carrie Sapienza, a lead groundskeeper guiding her team as it strapped the animal to the wooden pallet that the forklift would hoist. At one point, as Layla was moved out of the too narrow gate in her enclosure and onto the tarmac leading into the pachyderm house, she had to be lifted almost 10 feet in the air on the biggest of the vehicles to get her up and over the gate. Some staffers couldn't bear to watch the unexpected aerial show. "Do we have a heart rate?" asked the medical tech, noting Layla's condition periodically on a clipboard. 48, came the answer. The combined team of grounds crew and animal care staff maneuvered her into the hall and her snoozing head into the device's scanning ring. 3 times it rolled back and forth around her head, using X-rays and imaging software to create a 3D picture of the inside of Layla's skull. "This is the first live rhino we know of that's ever been scanned," said Brian Stevens of Nashville, manager of emerging products for Sound Technologies of Carlsbad, California, which operated the scanner. "The good news is the scan is beautiful," said Marina Ivankic, Brookfield veterinary radiologist. The bad news was that she, Atkinson, and the team spotted a fragment of the tooth still in there, and they planned Tuesday evening for another surgery to take that out and clean up whatever else they could get in hopes Layla's airways would be cleared. "The tooth and the tissue on the left side are the priority because that's where the infection lived," Atkinson said. Dr. Chris Downs of Chicago Equine Medical Center in Wakanda talked about that as he stood in the rhino's pen and waited for the animal to be brought to him so he could go back in. He is a horse surgeon by training, he said, and the skills are translatable in the sense that they're both large animals. That's about where it ends. But he is happy to be contributing, he said, to try to improve the animal's quality of life where she could possibly have a calf. Downs and the team spent about 3 hours on the surgery, Atkinson reported Wednesday morning. He was pleased with what had been accomplished. He said, "We got back out where the tooth had been to debride some more tissue in there." They may want to have another look in the future, he said, but for now they've left Layla with a couple of stitches in her face and essentially a roll of cotton packed inside to control the bleeding. In a few days, said Atkinson, medical staff will remove the cotton and the sutures. For that procedure, Layla will simply walk over and present her head as she's been trained to do, conscious the whole time. If you liked the video, please give it a thumbs up and consider sharing it with your friends and family. Thanks again, and we'll see you in the next one.